Okay, so Assalamu alaikum. A very warm welcome to everyone who's joined us from different parts of the world. My name is Sama Shams Chalil. I am the Administrative Coordinator at the Institute for Population Health at HealthWeill Cornell Medicine-Qatar. It is our pleasure to welcome you to the Health and You Community Wellness Series. The overall goal of the series is to create community awareness about health and disease. The ultimate objective of the series is to enhance self-care, reduce suffering, improve the quality of life, and increase healthy longevity. This is not a CME CPD activity and is aimed for the general public. Some housekeeping rules before we begin the session. Your cameras and microphones are turned off. Use the Q&A feature to type any questions or any comments if you may have. Questions will be addressed at the end of the session. And we repeat, this is not a CME CPD activity and no certificates of attendance will be issued. So the topic for today is on anger management. Dynamics of anger from flames to flourish. The session will discuss the nature of anger, its effect on health, and strategies to manage anger. And it is an honor and pleasure to welcome our expert speaker for today, Dr. Sohaila Cheema, Assistant Dean for the Institute for Population Health, IPH, and Associate Professor of Clinical Population Health Sciences at WCM-Q, WCM Cornell Medicine-Qatar. Dr. Cheema actively participates in oversight and implementation of IPH education, research, and community programs. She co-directs and teaches the various courses for our pre-medical and medical students at WCM-Q. Dr. Cheema serves as a faculty and course director for several continuous professional development or medical educational activities for building capacity in healthcare professionals. She is also a co-founder of the Lifestyle Medicine Interest Group and collaborates with private and government institutions to promote health awareness in Qatar. Dr. Sohaila Cheema, a medical doctor by training, completed her fellowship in integrative medicine at the Arizona Center for Integrative Medicine, University of Arizona. She is a diplomate of the International Board of Lifestyle Medicine and is a certified lifestyle medicine physician. She received her Master of Public Health degree from Johns Hopkins Bloomberg School of Public Health and is certified in public health by the National Board of Public Health Examiners, USA. A very warm welcome to you, Dr. Cheema. We are excited for your talk today. Over to you.
Thank you, Sama, for that very kind introduction. So I would like to just go ahead and just welcome all of our attendees today. I hope that you all are doing well, and I hope that we're going to have a great conversation today. So before I really, start, of course, I want to welcome everybody joining us from different parts of the world or from Qatar. So assalamu alaikum, good afternoon, good morning, wherever you are joining us from. So, of course, my presentation focuses on anger. So I thought we could start with questions, and you can go ahead and just, I'll just, say a few questions, and if you all can just go ahead and put your answer in the chat, I will be able to see it. So before I really start my presentation, I thought I'll ask a few questions from the attendees. So my first question to you all is, have you ever felt angry? So if you all could put an answer to that in the chat, please. Okay, I'm seeing yeses coming in. Good evening, Anne. Yes, regularly. Okay. Yes, most of the time. That's another answer I have. Good evening. All the day. So one response is all the day, for sure. Yes, a lot of the time, but mostly trying to control. Sometimes, that's another answer. Thank you for sharing. Okay, so I think we have, stable answers coming in. So it's become stable. I'll go on to the next question. And again, I think all of us, feel anger at any point in our lives, as we go through the day, at home, personal issues, work issues, stresses in life. We all have experienced anger, and that includes myself also, right? And again, we'll talk a little bit about what anger is, what the nature of anger is. So my next question to you is, give me some examples of what makes you angry. What is it that makes you angry? Okay, we have answers started to come in. So it could be work pressure, could be when you're irritable, if there's perceived disrespect, can be the hot weather also. We all are experiencing hot weather here in Doha with humidity. If somebody is ignoring you, if a person is disrespectful, yes. And if things are not done the way you want them to be done, rude people, disrespect, hormonal changes, you're tired, weather, workmates, physical conditions, hormonal changes. People can be judgmental, that makes you angry. Pandemic news, if there's a new pandemic news, right? Dealing with people, who are not thinking practically, work politics, anything which might irritate you. So again, fantastic answers, and thank you so much for sharing. So I'm really appreciative of that. And again, I think all the answers, that we've got. So there's another also about spouse not understanding situation. So I think a lot of us can really, connect with all these, that why do we get angry? I think a lot of us have gone, not only there's not one reason, but there might be multiple reasons why we can actually get angry. Okay, so my next question to you all is anger and aggression the same thing? What are your thoughts about that? So is anger and aggression the same thing? Okay, I'm getting no's. Yeah, I don't think so. Okay, and we're going to talk a little bit about that. So I just thought these were great questions, to start with. So I also have an understanding of what people are thinking, my attendees are thinking, and then we will be talking about these things. Aggression is a way of responding. It's a subset. Okay, so a vast majority do say that it is no, right? And that is the correct answer, but I will tell you exactly what anger is, what hostility is, what aggression is, right? And now my last question to you is, how do you deal with anger? What do you do? So the last question that I'm posing to you all for today is, for now, is how do you deal with anger on a regular basis or whenever anger comes to you? Okay, I have fantastic answers coming in. I will share some of those. So I have journaling, ignore the issue as I can, cry and pray, sit alone, usually take a deep breath, walk for a while, be quiet, go and stay alone, be calm and breathe, sit back and calm yourself, reflect on the situation, grounding technique, breathing exercises, stand up and go outside, walk alone, pray, do sabr, which is, be patient, inhale, exhale, be silent. So thank you so much again. My gratitude to all of you for sharing these. So I think a lot of people, we all deal with anger in many different ways. And all ways are fine. We just have to really understand what anger is, what is the nature of anger, what are the cues which are really triggering anger in us, and then see, okay, are there any strategies, for basically helping us deal with that anger? Okay, so thank you so much for sharing all these responses, great responses. And I am now going to just begin my presentation. So we'll talk a little bit about anger, and then we'll come down again in the end, and we'll be able to answer questions for you all. Okay, Sama, are we able to see the slideshow?
Yes, we can see your screen, Dr. Cheema.
Great, thank you so much. Okay, so these were just the questions. I thought we'll, just start with these, and thank you again for participating. So this is what we're going to talk about. So this is my disclosure statement. I don't have any financial, non-financial interests, in commercial products, services, and nor with any for-profit, non-for-profit organizations. Now, in the next maybe 30, 35 minutes, these are the three things that I will try and cover, okay? So I'll discuss what anger is, just so that we have clarity on what anger is. Then we'll see, okay, we all get angry, but if it's not controlled or poorly controlled, and if it becomes repetitive, what is the effect of anger on our health? Because obviously I want to keep good health. And then we'll see, okay, if I do get angry, what are some of the strategies that I can utilize to manage anger? So let's begin with the first one and talk about anger, really. So if you really say, okay, what is anger, right? So anger, you and I both know, it's often perceived negatively. It's associated with feelings like unhappiness, danger, aggression, impatience, and which are generally, they are not seen neither as healthy and nor are they helpful. And much of the time, if you really, look at it, these angry feelings, they stem from a sense of powerlessness. So when we can't fix or improve situations, like if I'm stuck in a traffic jam, or if there's a job loss, if there's a relationship breakup, or if I'm suffering from a chronic illness, a frustration, sadness, disappointed, and other negative emotions, they translate into anger. And additionally, anger can also be linked to long-standing feelings from experiences such as bullying, trauma, neglect, abuse, rejection, discrimination, or other struggles that may actually trace back to our childhood. Now, anger, of course, it's a natural part. Now, this is very important for us to understand that this is not something abnormal. We all feel anger. It's an emotion, okay? So anger, it's a natural part of our body's fight or flight response to threats. And it's basically controlled by a system in our body, which is the autonomic nervous system, which also manages other automatic processes like breathing, for example. Now, during this fight or flight response, what happens is that the stress hormones, they flood the body, right? So when the stress hormones flood the body, this causes our heart to start beating faster. It increases blood flow to the muscles, to the organs. The blood pressure, the pulse rate, they also increase, right? Your breathing quickens and you start to take in more oxygen. And this extra intake of oxygen is what, really sharpens your senses. And that also includes a sense of sight, of hearing, and you will feel much more alert. Additionally, the hormone epinephrine, we also call it adrenaline, it's part of the autonomic nervous system. It raises blood glucose levels. It provides more energy for action. And whether at that time I want to flee or fight, right? So you may want to flee from the situation, or you might actually want to confront when you are in that state. So it's this fight response that often turns anger into aggression. However, when anger doesn't help us address a threat or achieve a positive outcome, it needs to be managed, right? to prevent causing issues for ourselves and also for people around us. So if you look at the definition of anger, so anger is more than just a physical reaction, but it's a normal emotional response to a person, to a situation you believe has treated you unfairly or has otherwise been hurtful or harmful. Now, anger emerges, like I said, when you feel threatened, whether it's emotionally, physically, financially, or in any other way. Now, anger can also be caused by a wide variety of triggers, and though it has negative consequences on health and well-being, it is also actually crucial in motivating us to take action and approach rather than to avoid a confrontation. So now, while anger is considered a survival response, which is inherent in all living creatures, humans are endowed with the mental flexibility that really enables them to control and regulate their anger and then adapt it to socially acceptable norms. Now, since anger, it consists of physiological, cognitive, subjective, and behavioral components, it is really multidimensional. So it's really difficult, if we are going to define it in a single biological phenomena, right? So it's really multidimensional. Now, to talk a little bit about, is the anger level the same for all threats, frustrations, or provocation? The answer is, of course, no. The interpretation of any provocation, it can be influenced by the context and the situation, and also the level of arousal, which is experienced at that time. Say, for example, you're in a traffic jam. Now, okay, you're in a traffic, that may not necessarily automatically increase your anger. But maybe if you've been invited to a job interview and that traffic jam is blocking you from getting to that interview on time, this can cause, the individual to become angrier and perhaps even a more aggressive driver, okay? So the physiological arousal component of anger, it ranges from minimal arousal to continued sympathetic activation, and that leads on to increased muscle tension and, of course, adrenaline release. Now, let's look at what the dimensions of anger are. The dimensions of anger are twofold. So when you think of anger, think that it has two dimensions, which are the valence and then the arousal, okay? Now, the valence of an emotion, it's based on the emotion evoking event, right? And of course, for anger, there is negative valence, right? So positive valence is, of course, pleasant, whereas negative valence is unpleasant. And anger, we all know, is a negative emotion. However, anger really differs from other negative emotions, for example, fear, sadness, and disgust, because it really motivates, approach tendencies and action readiness rather than avoidance tendencies. So when you're fearful, sad, you want to move away, right? You want to avoid, you want to withdraw. But again, anger is different in that sense, that it actually motivates approach tendencies and action readiness. Also, anger is a natural emotional physiological response, and primarily it's defined as negative valence and high in arousal. Now, the situations that elicit anger, they are generally experienced as unpleasant, undesirable, and aversive to us. So anger arouses and it preserves high level of energy and quickly increases, our motoric mobility. It directs blood to the muscles to prepare the body for action. So anger actually sometimes makes people feel stronger and more prepared to attack, fight, or assault, the cause of what is causing that anger. So there are some characteristics they've seen that affect anger, and you might relate to some of this. So research actually suggests that males have higher levels of anger than females. And I'm not saying this because I'm a female, but this is what research suggests. Then age. So what research also indicates is that you may have the highest level of anger between the ages of 30 years and 50 years, and the lowest level of anger after the age of 80. Also, it is seen that older adults, they are more stable in their emotions and they are less impacted by stressors than younger adults. And I think all of you can relate to that, that what might, when we were younger, stress us out, make us angry, as we age, or I like to call it as we become younger, basically you see that we are better able to deal, with the different emotions, with different stressors, and you may actually become angrier lesser. And college students also, they've seen that they differ from non-college going students. And what they've seen is that late adolescence, when you start college, is a time in life when people can actually feel more overwhelmed by their own emotions. And they also tend to feel less empathetic about, others than later on in adulthood. Culture also is a characteristic where they've seen there are different norms for expressing and experiencing emotions across cultures. And what they've seen is that compared to individualistic cultures, collectivistic cultures, they encourage the suppression of negative emotions, and anger is included in them. Now, I think what is really important for us to understand is that anger isn't an emotion to be eliminated, but it's rather one to be channeled in constructive ways. So happiness and contentment, they aren't enough to tackle all of life's challenges. And we really need that full complement, of emotions to succeed in jobs and relationships and the day-to-day matters that affect us directly or indirectly. But because of the risks that are associated with poorly controlled anger, it's good to know how to manage this emotional response. So here is, that question, are hostility, anger, and aggression the same? I'll just go through each so we can just try and distinguish, what the difference is. Now, basically, when we talk about hostility, it refers to the cognitive aspect of anger, right? As separate from the physiological arousal and overt behavior. And hostility is rooted in a set of negative beliefs about the general nature of humans. So it's really a negative attitude or cognitive traits, judgments that are directed towards others that motivate the aggressive behavior. Okay? So basically, although both anger and hostility, they involve negative affect, and they can really arise in response to perceived threats or injustice. Anger, it's primarily associated with an intense emotion, which is characterized by physiological arousal and a strong desire to confront the source of the perceived harm or wrongdoing. And in contrast, hostility really refers to a more enduring and pervasive disposition that's characterized by a general negative outlook towards others. And hostility is really often more reflective of beliefs and attitudes, okay? So hostility is more reflective of beliefs and attitudes. Anger, we've already said this, it's an internal emotion, right? And it's a state that consists of feelings that may vary in intensity from mild irritation or annoyance to intense fury. Now, going on to talk about aggression. Now, aggression, it's really an external behavior. So aggression should be distinguished from anger, even though aggression can be a way of expressing anger. Okay, so aggression, it refers to any form of behavior which is directed towards the goal of harming or injuring another living being who's motivated to avoid such treatments. So aggression is a verbal or physical behavioral pattern, can manifest in yelling, in intimidation, or physical assault, right? Hitting or anything of that effect. So we've spoken about what the nature of anger is, the dimensions of anger, are hostility, anger, aggression the same? And now we'll move on to what is the effect of anger on health? How does anger manifest, right? So if we look at the manifestation of anger, it could be internal, it could be external. You can have angry feelings that, just eat you up inside, while you maintain even just a natural or even pleasant outward demeanor, right? So nobody can really tell, but inside maybe, you have an inferno, like there's a fire inside you. Or you can also behave angrily by shouting, you can slam the door, you can, send an inflammatory text or an email, or otherwise, letting those feelings to be known to people around you, right? So you can be very quiet about it, or you can be very open and explosive about it, so that everybody knows that you're angry at this point. So let's say this clearly. Of course, it's important to control the outward manifestations of anger so that we can prevent harm to yourself or to others also. But dealing with internal anger is also very important. We have to deal with internal anger if you want to stay healthy. It's not simply just a matter of repressing or ignoring the feelings. And studies have really shown that, if you hide your anger, if you hold the anger inside you, it can have negative, psychological and physical health consequences. And I've listed some of these here. It can lead to high blood pressure. And of course, we all know that high blood pressure has a risk for stroke, for heart attacks, for kidney disease. Also, holding on to anger, it can actually lead to gastrointestinal distress. It can increase your heart rate. It'll, lead to muscle tension, where people start developing, backaches or neck aches or lower backache, where you've got too much tension in your muscles. You may have tingling sensations. You may have chronic pain. You may have headaches. Also, the list goes on. It can also manifest as skin disorders. It can manifest as insomnia, which means that you can't sleep at night. In younger people and adolescents, it can also cause eating disorders like bulimia. It can also result in diabetes. Why? Because anger in some people, it can lead to poor lifestyle behaviors. Sometimes when we are angry, we might do some emotional eating. We might want to eat more junk food. So these kind of behaviors, if we continue, if they're consistent, they're persistent, it can lead to diabetes. Then also driving anger. And you might have seen or heard of road rage. You might have seen aggressive drivers on the road here, even in Qatar, if you're joining us from Qatar. And what that driving anger can do is basically it can lead to a road traffic crash. Then in adolescence, of course, anger expression, again, move you towards more bad habits, increase intake of soda, of coffee, maybe even these sugary drinks which are available, high in caffeine. They maybe, if they want to do anger suppression, it might lead to increased intake of alcohol in younger adults if they're not able to manage their anger. Then we also have emotional manifestations of anger. And those could just come out as being irritable. You don't want to talk to anybody. You don't want to look at them. You don't want to sit and enjoy something. You're irritable all the time. You're frustrated. Anxiety can occur if you're just an angry person, and if you think you're going to go into situations and you don't know how to deal with your anger, it can lead to chronic anxiety also. Some people may experience anger as, rage. And then, of course, stress, the feeling of feeling guilty that, you're not being nice to somebody, you were angry in that moment and you said whatever you said, and then later on feel guilty. And then feelings of being overwhelmed. as a continuation of that, what are the effects of chronic, poorly controlled anger? Now, of course, we all know in our normal lives, it can lead to relationship breakups. It can lead to estrangement from family members. Nobody wants to meet you because you're such an angry person or you react to everything. People don't want to talk to you. Workplace discord. So again, if your co-workers, your co-mates, who are colleagues who are working with you, always find you where you are either responding to them in anger or just frustrated or don't want to listen, again, it can lead to workplace discord, right? And in these situations, they can become very toxic situations. And you don't want to work in these kind of environments because, again, then they will have effect on the health of the individual and even for all your colleagues. There might be increased levels of anxiety, depression. It also affects episodic memory. And in extreme cases, behaviors can actually, then land a person in legal or financial distress or even in jail. All right. So we've spoken about anger, what the nature of anger is, what are its effects on our health, and what are its effects if it's not controlled and what it can do, so it has a wide variety of effects. So the next question is, of course, let's look at some strategies to manage anger. So what is it that I should be doing? So of course, if you say to a person who's angry that, you're angry, maybe you should, a lot of the time the person will say, I'm not angry. So again, that's not the right way to think about anger. We all, again, go through anger, and it's absolutely normal to feel anger. But what our goal really should be that we want to reduce the impact of intense emotions and their physical effects. And also you want to become more skillful, in your responses to the triggers instead of really resorting to violence, aggression, or other regrettable behaviors. So most experts will basically agree that anger is a problem when it is too frequent, too intense, too prolonged, or if it is managed ineffectively, right? So how do we do effective anger management? So definitely, you want to deal with an anger after an outburst. But I think more importantly, it's how do I prevent that outburst in the first place? I think that is key. If we know how to prevent, and again, a lot of our focus and a lot of the work that we do with the community is, okay, how can I prevent from, developing this negative emotion? Or how do I sort of then deal with it? So let's see what it is that we can do. Now, the first question to ask yourself is, what is it that triggers that anger? Because each of us are unique, right? So you will be different in how you react to anger. I am different in how I react. Sama, who just introduced me, she's different in how she reacts to anger. And what is it that specifically makes us angry, right? Now, this is really the first step in gaining a better understanding of your anger and figuring out really what is it that really makes you angry. Because everyone, again, has a unique set of triggers. You may be somebody, who loses their temper quickly when things don't go according to a plan, or, you're thrown off your schedule, or you can get angry when conversation turns to politics. That's, again, a trigger for you. Maybe if you have to wait for a long time in the bus, you're waiting in a line, on the phone in an office, if you're stuck in a traffic jam, in a crowded bus, if a co-worker, like some of you also alluded to, if a co-worker says something hurtful or untrue, or if they're rude to you, then sometimes, having to clean up somebody else's mess where somebody said, okay, you ask somebody to do something, then they can't do it, and things like that. Maybe you have neighbors who are inconsiderate. So again, if you harbor anger about hurts or slights even from years ago, maybe there was something that happened in your childhood, And that becomes a trigger for you, because if that has happened, it stays in your memories, and that trigger really reminds you of those painful episodes, which can also make you upset, right? So knowing what those triggers are, this will likely allow you to anticipate your reaction and then help you choose a more useful response. So let's see how you can recognize how you can respond to anger. Let's look at those strategies. So basically, you need to recognize how are you responding to anger, right? So are you getting verbal outbursts, which means that you have the outburst, you say things in anger, and later on you regret. Worse, sometimes it also happens that you may not even recall what you said. And then if you do recall, you may feel no remorse or guilt that what you said, you don't care if somebody else was hurt, was disrespected, you were rude to somebody, but you just went ahead and said whatever you wanted to say. So you are having a verbal outburst in response to the anger that you're feeling. Then ruminating over negative or painful memories. This is also something what people can do in response to anger. You find yourself returning again and again to moments in your life that really stir up anger, frustration. So you on the repeat are thinking about those things again and again. Self-loathing, and what that means is that you might feel isolated, alienated, unloved. You might feel underachieving. It can lead to anger with yourself for not having more financial or professional success, or even a more robust social life or lasting relationships. Then blaming can also happen when you're angry. You're often looking for other people to blame for your problems or for challenges in society, that he or she is the cause of, it's because of this that I'm angry. So you do the blaming technique. Also, people can overreact. So you hear something that bothers you on the news, maybe, or somebody shares anything with you, you encounter some minor inconvenience. But what happens is that your response, it really exceeds the magnitude of the bad news or the problem, right? So again, it's an overreaction to what you heard. Then you can also have negative outlook. Like you see problems everywhere. You are quick to start arguments. Everything and anything anybody says is not right. You're generally unhappy, right? And then your vision of the future is hopeless, then hopeful, right? So again, a negative outlook on everything, where you just sort of, are looking at the negative aspect of anything and everything. And then a physical outburst, right? So you may, again, like go slam a door, you might throw something, or you might break something even, or decide to strike people, or storm out of the room. This is a physical outburst, right? So you're recognizing. So again, look at this list and see how is it that you respond to anger. It could be any of these things. It could be a combination of these things. So this is important for you to recognize, right? So now, once you recognize how you really respond to anger, so the question is, what's next? Okay. So what we have to do is this. You have to become friends with your anger. You need to accept, you need to allow yourself to experience that anger along with all the feelings that it brings. Be non-judgmental for all the thoughts and feelings you're experiencing. We also refer to this as mindfulness, right? So mindfulness, again, is a technique where rather than, getting trapped in memories or stories connected to the feelings, just try and stay with the emotions, the sensations that this anger really arouses in the body. And then slowly you want to intentionally return your attention back to your breath, right? Your breathing or sounds as your emotions fade. So by practicing mindfully being with rather than acting on angry feelings, we can really learn how to manage rather than suppress them. So you should always just try to focus on those sensations, those inside your body, that you're feeling, like your breath, those around you. Maybe there are sounds. So should an emotion such as sadness, joy, or fear, or anger arise, you simply pay attention to the sensations of those emotions and where are they arising in your body. And what you need to do is you need to move past that anger by finding a new perspective. Now, how can I find that new perspective? Let's look at a few pointers, right? So take a moment to size up the situation. The first step really is to find a new perspective. It can be really simple as imagining that the person, maybe who's keeping you waiting for an appointment, they had to take a call about a loved one in the hospital or some other urgent matter. But of course, you want to find a balanced and a reasonable perspective. And it's difficult. It's not easy, right? Because every problem is unique. But again, these are just some strategies that you can apply to anything. So take a moment to size up the situation. Don't jump to conclusions or assume the worst, right? A lot of the times we are reacting to what somebody said or to a situation, so it's more reactionary. So don't jump to conclusions, assume the worst. Break it down. So break down a big problem into smaller, more manageable challenges. Consider a variety of approaches. Maybe one approach doesn't work, then try another one. If that doesn't work, try another one, maybe a combination of some. Ask for help. If you have people around you who can listen to you, maybe you can go to somebody and talk about it, then ask for that help. Then be willing also to change your approach early if that approach is not working, and evaluate what's worked, what could have been done differently. So when the situation really presents itself again, then you'll have a more confident and thoughtful solution at hand. So let's look at some self-help strategies. Now, if you're in the moment of anger, what is it that you and I can do, which can help us to address anger, right? In that moment of anger, what is it that you and I both can do and practice? So the first thing you definitely should think about is take a pause, just time out, right? You need to pause, you need to cool off. You could simply just walk away and collect your thoughts. And what this does is really, it can prevent a situation from escalating, right? And from you saying something that you might later on regret. So taking quiet breaths occasionally is also a good idea, whether you're feeling angry or not. And practices like this, actually have long-term benefits, and they will help you handle the next stressful thing that comes along without acting angrily. Then think before you speak, right? Once you're calm, express your concerns. So what that means is you want to calmly share your feelings. While it's helpful, to avoid saying things in anger in a way that you'll regret, you may still need to be able to express your feelings and concerns. So the key is you want to be assertive, and assertive again, and not aggressive. So assertive really means is that I'm full of your emotions and also of mine. So we are respectful, giving respect to both, right? So again, it's important. Sharing your frustrations or other emotions in ways that aren't confrontational and accusatory, it can spare the feelings of others, right? While also still allowing you to feel that you've actually been heard. So they've also seen that techniques like using I statements rather than you, or you did this, and this has happened because of you use I statements to say, for example, I'm feeling hurt, maybe because you disrespected me, or you seldom call home now. So rather than you don't call anymore, you've forgotten me, you can just shift to I statements. Okay. And exercise. Exercise, physical activity in any kind, there is a large amount of research available that this will help you. Exercise, has mood boosting benefits. So these are very well documented. And regular exercise, again, has shown that you can really maintain health. You can maintain a positive outlook on things. And even a single burst of physical activity, it really has a positive mood enhancing benefit. But they have seen, and I just wanted to mention that some different kinds of exercise have different effects. So research has shown that maybe jogging is not a good idea, when you're angry on the treadmill or things like that. But if you play some sport, together, ball sports, so they've seen that these actually help you in dealing with the anger. Okay, so exercise again is a great way in how you can deal with anger. Then we move on. Relocate. Relocate really just means sometimes you want to just change the scenery. It'll be enough to just bring a perspective to a situation, right? So you don't necessarily, of course, have to shift jobs or move to a new home just to find some relief, but maybe you need to, take a break, walk outside your office. If you're at home and in a room, go outside. If you have a garden, just go for a few minutes, things like that. So relocate, it just helps provide you a different perspective on the situation. Then distract yourself. So anger, of course, can be an all-consuming sensation, but it can often be tempered if you occupy yourself with something else, right? So some people will start cleaning. If you're angry, so they'll start cleaning, maybe do some other chores, because it helps distract you. Maybe you want to go read a little bit, or maybe some people may want to go watch television, and it really just helps you get out of that angry headspace. Then relaxation. Now, relaxation, of course, is extremely important in situations like there's, again, plenty of literature, plenty of published studies which show you that breathing, any kind of meditation, mindfulness, all of these kind of activities, they effectively reduce. There is no doubt about that, right? And again, breathing exercises are very simplistic, but very, very important and effective. So if you're in a situation where you are angry, try it the next time. There's a commonly used exercise which we call as the 4-7-8 method, right? And what that means is, and if you want, you could just try it, but basically you just inhale for 4 seconds, right? So you do a long inhale for 4 seconds. You're going to hold that breath for 7 seconds, and you should just count slowly. 4 seconds, you do 1, 2, 3, 4. You hold that breath for 7 seconds, and then in 8 seconds, you release all that breath out of you. And you can do it in a sound, like where you actually hear yourself releasing that breath out from you. So it's called the 4-7-8 method. If you practice it on a continual basis, you will see it has a lot of relaxation effect. Even in your normal day-to-day, even maybe when you go to work, in the morning when you start, even in moments where you feel angry, you can try this technique. So where you're really looking at your breathing and seeing where that breath is coming, how you're taking that breath, how you release that breath, really focusing on the breath. So it has a lot of advantages, okay? And then forgiveness. I think this is really, really key. Also, don't hold a grudge. We have to learn how to forget to move on. If we don't, and we just hoard those angry feelings inside us, it's not going to work to our advantage. Another technique that, if like somebody had mentioned that, okay, I feel angry all the time, or sometimes, or so this is an example of a self-help diary that you can use. You can just, keep a piece of paper if you want, put it in your notes. So what you want to try and do is, again, to help yourself, you want to look at the event, right? The trigger. So what was it that triggered my anger? And then what are the cues? Like, how did you respond to it? Was it physical? How did your body respond? Was there increase in heart rate? Did I start feeling hot, flushed? Was there chest tightness? Was it behavioral? What is it that you did, right? When you felt angry, did you start clenching your teeth? Did you start clenching your fists? Did you raise your voice? Did you start staring at somebody? Or was it emotional? Other feelings like, okay, you started to feel fear, you started to feel jealous, disrespect, or was it cognitive? What was the cognitive cues that you were feeling? What did you think about in response to the event? Hostile self-talk, images of aggression or revenge, where you're thinking about maybe, oh, I'm going to be, if I had a hammer here, I would have definitely, smashed his face. So is it something like that that you're feeling? You can actually just write that down. And this really then helps you focus on what it is, how your body is reacting, what was it that triggered it, and then use some of the tools that we've spoken about, right? What is it that I can do? Did I walk away? Did I, take a couple of breaths? Did I just calm myself by maybe doing a 2-minute meditation exercise? So what is it that I did? Which are the tools to respond? And these, as you practice, you will see that it really helps you define, what is really triggering your anger, how is it that you react, and what are some of the tools that work for you. So self-directed strategies, they can be effective for many people, but if anger management, obviously, it seems more than you can handle on your own, then please consider getting the assistance of a mental health professional. It's extremely important. If anger is something which is continuous, which is something that you cannot deal with, you are feeling angry all the time, or vast majority of the time, you cannot deal with it, you have a lot of negativity inside you, please get help. If you have some loved ones who are experiencing something like that, please try and get them help. So again, I have just spoken generally about self-care and self-help strategies, self-directed strategies. But if a situation is such that you cannot handle, you're going to go into anger management. And there are many different therapies, the health professionals use. There's something called as cognitive behavioral therapy. And what that approach does is that basically the undesirable behaviors, which are driven by negative or unhelpful thoughts and feelings, we know. So what CBD does, it helps you change the way that you think about the situation. So your feelings will change, and as a result, the unwanted behaviors may be replaced by less problematic and positive behaviors. And CBT also focuses on skills training. So basically what happens is that you'll have coping strategies to help you deal with everyday challenges. So for example, if an event has happened, we look at what it is that were your beliefs around activating that event, right? So it's not the event themselves that produce those feelings of anger. It's really an interpretation and belief about that event. And this is which leads to emotional consequences, right? So these are experienced as a result of interpretations and beliefs concerning that event. And the way we really identify any maladaptive habits, beliefs, and disputing them with more realistic ways of looking at the activating event, right? So cognitive behavioral therapy, it's really a type of talk therapy. It helps people understand how thoughts affect emotions and behaviors. Then there's something called as dialectical behavioral therapy. I'm not going to go into depth about it, but it's really a type of talk therapy also, and it's based on CBD also, but it's specially just adapted for people who experience very intense, they really experience the emotions very intensely. That's what it means, and it's effective for those people who have difficulty managing and regulating their emotions. Of course, there might be couples or families who need therapy. Then in depression and anxiety, with anger and mood disorders, you need help. And also if people are indulging in substance use like drugs, alcohol, or both. So let's look at some anger myths. So let's look at myth number 1. So one of the myths about anger is that the way you express anger, it cannot be changed, right? So again, our facial expressions and our nervous system's response when we become angry, yes, they are inherited, but what we do next, meaning our behavior, it's learned. So because people are not born with set specific ways of expressing anger, it is possible to learn more appropriate ways of expressing anger. And similarly, it's also possible to change the way that your nervous system reacts after you get angry. So you can learn to calm down more quickly with practice. So this is a myth that you cannot, the way you express anger cannot, that's not right. Then there's another myth that anger automatically leads to aggression. So again, this is a myth also, right? So a related myth is about the misconception that anger, the only effective way to express anger is through aggression. But there are many other more constructive and assertive ways to express anger. And effective anger management, it really involves controlling the escalation of anger by learning assertiveness skills, changing negative and hostile thoughts or self-talk. You challenge irrational beliefs, and also by employing a variety of behavioral strategies. Myth number 3, you must be aggressive to get what you want. Now, many people confuse assertiveness with aggression. Now, the goal of aggression is to dominate, intimidate, harm, or injure another person. But the goal of assertiveness, on the other hand, is to express feelings of anger in a way that is respectful of other people. Myth number 4, venting anger is always desirable. So for many, many years, there's a popular belief that the aggressive expression of anger, such as screaming or beating on pillows, it's healthy and therapeutic. But research studies have found, however, that people who vent their anger aggressively, they simply just get better at becoming angry. So in other words, venting anger in an aggressive manner, it really reinforces that aggressive behavior. So I'm just coming to a conclusion, just the last couple of slides. Now, the question to ask yourself is this: do you have anger issues? And again, I am not here to tell you whether you have or not. Here is a list, but if that I've put together, you may have anger issues if you feel angry often, it's chronic irritation, impatience, hostility. You feel that your anger seems out of control. Your anger is affecting your relationships. Your anger is hurting others. Your anger causes you to say or do things you regret. You're verbally or physically abusive. You indulge in excessively risky behaviors. You have frequent arguments of escalating intensity. You predominantly focus on negative thoughts and experience. You threaten violence, and it could be both for people and for property. So if anger is really displayed frequently and aggressively, it can become a maladaptive habit. And we all know that a habit by definition is what? It just means performing that behavior automatically over and over again without thinking. So the frequent and aggressive expression of anger, it can be viewed as a maladaptive habit because it really results in negative consequences. And I'll leave you with this saying, from Lawrence Douglas Wilder. And he says, anger doesn't solve anything, it builds nothing, but it can destroy everything. So folks, I've shared some self-care strategies with you about managing anger. We've spoken about what anger is, the dimensions, its effect it can have on health if it is continued and persistent. And of course, very important, how can I prevent really that outburst of anger from happening? Here are some resources if any of you want to, also refer to them: National Institutes of Mental Health, the American Psychological Association, the National Center of Complementary Integrative Health. They talk about meditation, mindfulness, and there are many, many now free YouTube videos and all which are available, which you can actually use, to help with breathing techniques, with meditation, with relaxation techniques. You can utilize them at your leisure, basically. So thank you very much to everyone who attended. I'm really, really grateful and appreciative. And I look forward to seeing you at all our other sessions. We have a great lineup of talks happening each month. As you all know, a lot of you all come back to our talks. I think the one in September is on climate health, on climate change, and how climate, is climate really affecting your health? So extremely important topic for us to be aware about. So I'm hoping to see many of you return to that and also in all the consequent ones that we host. So my deep gratitude to all of you again for joining me for this session. And I hope we can all become better human beings. And I hope you all can take away some key messages from this so we can better address anger in our lives. So assalamu alaikum, and thank you very much, and hope to see you all soon again at the next iteration. Bye-bye for now.